Hello everyone and welcome to Inside Healthcare. Last spring, Carol Kraft went to a local hospital for what she thought was a routine surgery. She told her coworkers she'd be back to work the following week. But it was months before she was able to get her life back and return to work. Here's Carol's incredible story.
I went in for surgery, and then a week later I had some complications which resulted in an emergency surgery. And during that emergency surgery I had a lot of complications, including the fact that I aspirated, and that led to my having pneumonia, my having ARDS, several infections, and the result of that was I almost didn't make it off of the operating table. At the time I arrived at Bethesda, I was still on a respirator. I had a tracheotomy. I couldn't walk, I couldn't talk, I couldn't write my name. My team of doctors at Bethesda were absolutely fabulous with me. And you know, one of the things I've always said about Bethesda is that they really got to know me, and so it wasn't just to come in my room and you know, give me, you know, more medicine and leave. I mean, they really got to know me, and you know, we had personal conversations about, you know, our lives. So I feel I got to know the doctors, the nurses aides were just, they were all fabulous. And the first step that I took, my toe kind of dragged on the mat, and then I took that first step and it was like the second one just had to come. So I got all the way to the end of the parallel bars, and it was just so emotional. And of course I told Eileen I loved her, and it was just incredibly emotional that I had been able to walk after a couple months and had not done that. Well, it was pretty emotional. No, get emotional now. Pretty emotional. There's a lot of things in that have kept me going. It's the power of people, the power of prayer, positive energy. I think a combination of all of those things, really can get you where you want to be.
And I checked with Carol before this broadcast, and she says she's doing very well now. Her advice to anyone having surgery: listen to your instincts. She wishes now that she had. After hearing Carol's story, and since this is National Patient Safety Awareness Week, we thought we would bring back someone to talk about patient safety. We have with us Beth Ferguson. She's been with us in the past, Director of Medication Safety and Pharmacy Education at Health East. Thank you, Beth.
Thank you.
And also familiar face to the show is Dr. Craig Svensson, Health East Chief Medical Quality Officer. Thank you for coming back. It's always great to have you here. So, Beth, when someone's going to go to the hospital, what advice do you have for them to make sure that their experience is as safe as possible? What can they do?
Well, Carol's story really demonstrates to us that there's even simple procedures and surgeries can become very complicated. A program that's going on right now and sponsored by the Joint Commission, which is our national healthcare accrediting body, is the Speak Up campaign. And really it includes some very simple steps. One of course is speak up and ask questions if you have concerns. It's your body, you have the right to know. Participate in your treatment. Ask questions about your care, and make sure that you're receiving the right treatment, the right medications from the right healthcare professionals. Educate yourself about your disease state or your illness. Understand the medical tests involved and the treatment plan that you have. And always understand your medications. Make sure that you keep a list of your medications. and you keep that list in your purse, in your wallet, and you know what medications you take and why. And always participate in your healthcare decisions. Make sure that you are part of the decision-making bodies as you go forward with your care.
I would think, especially for some, maybe our older family members, that might be more of a challenge, that, you know, the doctor says this and they don't question it, and you're asking them to speak up and maybe question what they're saying, or they're saying, you know, what's happening, or...
You always have that choice to make that decision. Don't be afraid to ask questions. It's your health care. You need to be involved with that care.
And if you're not capable, maybe have a loved one?
Yes, always have an advocate or a family member that's available to ask questions when you don't think of those things.
You know, here in Minnesota, we're very fortunate that we have some of the highest quality in the country. You know, we have some of the safest records around. So what are some of the biggest health threats and concerns to people, Dr. Swenson, when going to the hospital, going to the clinic, things like that, and what is being done to reduce and minimize those concerns?
Well, thinking of hospital stays, and the hospitals do wonderful things for all of us. However, it's a very high-risk environment, really. The cares that you're receiving are very sophisticated. So some of the things that we at the hospital are trying to accomplish is safe site surgery, you know, making certain that the right patient gets the right procedure at the right time on the right body part. We're also working to decrease hospital-acquired infections. Carol was on a ventilator for quite some time, and there are specific steps that we take to try to decrease the risk of infection while you're on a breathing machine or a ventilator.
On a ventilator are at a higher risk for developing some of those infections?
That is correct. That is correct. So we're taking a lot of steps to prevent infections due to your treatment in the hospital. Also, we're looking at tissue integrity or bed sores. You know, what can be done? You're laying in bed, you're in a weakened condition, not moving around in bed sometimes.
And so, months at end.
Months at end, and again, Carol, with 3 months of hospital stay, puts her at high risk for development of a bed sore unless we take specific steps to keep the patient off the pressure points on their body.
So what would be some of those things that you do to ensure that they don't get pressure ulcers, that they don't get infections and things like that?
Well, thinking of the bed sore issue, we assess each patient for their nutritional status. How well are they eating? How well were they eating before they arrived in the hospital? And now that they're ill, how are they eating right now? Because nutrition has a lot to do with the health of the skin.
You don't even think of that, do you?
Don't even think
Make that
of
connection between the stomach and the skin.
And then we think about, okay, how mobile are they? Are they just quietly laying in bed? Are they not fully awake during their hospital stay? And without moving, it puts pressure on areas of the skin, which compromises the circulation in that area. And it can create a sore. Sores that wouldn't develop for you and I sitting in a chair. We get uncomfortable, we shift our weight in our chair, and that's our body warning us, hey, this area, getting too much pressure, need to get the circulation going. So we work with patients, and on a regular basis, every hour, hour and a half, we're with the patient, shifting them to a different side, putting them into a chair instead of the bed, and making certain that they're not putting their skin at risk. So that's what we would do to help protect against the bed sores.
What about infections? What are some things that you might do there?
Infections, what we look at there, already spoke briefly about the breathing machine or the ventilator and things that we look after there. But many of us, when we're in the hospital, have tubes going into our veins, going into our arteries. Sometimes instead of just being a tube into an arm vein, it actually goes all the way into the central circulation of the chest. We have to be very careful at how we manage that IV line. How do we put it in? How careful are we with hand washing and cleansing the area of the skin to put that in? And then on a daily basis, what are those steps we need to do to keep the area clean and prevent the infections? Because bloodstream infections are a common problem when you have a intravenous line into that vein for a prolonged period of time. And then lastly, the other one is catheters, bladder catheters. You know, some of us, when we're in the hospital, think, wow, I don't want to get up to go to the bathroom. That catheter might be something of a convenience, if you will, even though it's uncomfortable. But that itself can promote infection. So we try to not use those catheters unless absolutely possible.
Is there anything from the patient side that they can be an advocate to try to prevent some of these things? Is there things that they can be doing when they're in the hospital?
Well, when they're in the hospital, the staff, the patient themselves, and their family members, everyone, wash your hands. Mom told us to do that, you know, when we were coming in from playing. Washing our hands is very critical. And it is for the patient as well as nurses, doctors, and your loved ones that are coming to visit you, neighbors or whoever. Always wash the hands coming into the patient room and leaving the patient room, and that will go a long way to prevent those infections.
And what advice do you have on the proper way to wash your hands? I mean, is it enough just to use the lotions? Do you have to use the soap and water? Is that better, preferred?
In the hospital, there's actually two options. We have soap and water, you know, getting a good lather on those hands and spending 3 minutes of washing your hands with soap and water.
3 minutes.
3 minutes.
That's a lot of time.
There's also products that are available, and they are in the patient rooms, that are hand sanitizers. They look like lotion. They look like pick your brand of lotion, but they're actually disinfectants, and that doesn't require the full 3 minutes, but it requires a good hand rub with that material.
And Beth, with your expertise in medication, what would be some typical, I understand medication errors are some of the biggest problems that we encounter.
Yes, that's correct. The most important thing you can do is keep a list of your medications. Make sure that list is always up to date. Make sure you include all prescription medications, over-the-counter medications, any vitamins or herbal products you might take. Make sure you include your allergy information on that list, as well as any sensitivities or reactions you may have had. And make sure you carry that list with you at all times. Share it with your physician or your nurse when you enter the hospital. Always make sure you know the medications you're on, understand what those medications are for, any information regarding the dosages and how you take those medications and what time of day, and also any side effects that you could experience, and if you do experience them, what you should do. So it's very important to keep that list up to date all the time on you, in your purse or your wallet, and make sure you share it with your healthcare team.
I thought that was a good point that you mentioned too about the herbal things. I think people don't think, oh, that's natural, I don't need to be worried about that, but there are some concerns with that.
Oh, definitely. A lot of the herbal medications have drug interactions with prescription medications. So it's very important that both your physician, your pharmacist, your nurse are all informed of those herbal medications so they can watch for any signs of interactions or adverse reactions from those medications.
And this is something, again, perhaps a loved one should help out with, an elderly mother or father or someone like that?
Definitely. If you can have a family member or a friend that's an advocate for you, it helps you keep that list up to date, understands the medications you take, and then can help ask those questions when you're stressed or unable to think of the questions you should be asking. It's very important to have that person involved.
Some other general tips for a safe stay at the hospital?
For a safe stay at the hospital, I really want to emphasize what we've just been sharing about that communication. As patient, as family, understanding what is happening, know the language. You know, as doctors and medical personnel, we use fancy language that describes things that you're not familiar with. If you don't understand
there's so much.
There is so much. So you need to ask when you don't understand. You know, the good providers will take the time to explain and answer the questions that you have. If you're going to have a test, why are you having that test? What exactly is the test? So that you know when you arrive for that test that it seems to be the right one that you're experiencing, so that you're not having that wrong test accomplished. And then again, around medications, it is so important to have your own list of medications, but also understand why it is that you're taking a given medicine. Very important that you have all of that understanding.
You know, with people, with the internet being around, and people right away, they go to the internet for a lot of their questions, their medical questions. What advice would you give to them as far as how that can be a help and not a hindrance in their care and stuff?
Use of the internet, it's a good place to get some fundamental information. The challenge is you don't always know the caliber of the information that you're reading. Certainly there are some great websites with well-written instructions and information about conditions. Print that off, bring it in to your physician or your caregiver and ask the questions that might be generated from that. When you access information about medications, however, I like patients to understand that there are 4 or 5 different reasons that I might use the same medication. So while you might be on a water pill, there's many purposes for you to be on that water pill that I might have prescribed. So when you're on the internet, you might be reading, well, that water pill is for heart failure. Well, I'm really using it with you because of ankle swelling because of the veins in your legs or other reasons. So you have to ask your doctor or the prescriber, why is it that I'm on this medicine and how long am I going to be taking this?
And Beth, should you be posing questions or talking and have a dialogue with your pharmacist as well on some of the medications?
Absolutely. They have answers that they can help you with, or if they feel you need to consult your physician, they can steer you in that direction. But definitely have that open dialogue and questions with your pharmacist.
If someone has questions about patient safety, where can they get some more information?
We have some resources available on our website at www.healtheast.org under patient safety, and there's actually a My Medicine list there that they can download and print and use that to track their medications.
That's good advice. Final comments for our viewers on patient safety during this National Patient Safety Week?
Ask lots of questions, get answers to the questions that you have, and ask for help from your providers when you have a need for it.
That's what they're there for.
That's what they're there for.
Beth, final comments as well?
Nope, just keep that medicine list up to date and active.
Well, I appreciate you both coming back and joining us. It's always a pleasure to have you with us. Hope you'll come back again.
You're welcome.
Thank you very much.
Thank you.
Still ahead, there is a virus, a highly contagious virus, that's making the rounds this year in the Twin Cities. Stay with us. We'll have some information about it.
There's a place not so far away, a place where you don't have to keep the volume down. You'll find all sorts of creatures in this place without have to. The silly you, the proud you. You may even meet the curious you.
It's tickling me! You!
Ask your parents to take you to this not so far away place. Come to the forest, where the other you lives. But first, stop by discovertheforest.org.
Welcome back to Inside Healthcare. You may have heard how Noravirus made hundreds of passengers very sick on a couple of cruise ships, and it is now affecting lots of people around here in the Twin Cities in Minnesota. And joining us now to talk about Noravirus, we're pleased to have with us Boyd Wilson. He's the System Director of Infection and Prevention at Healtheast. Thank you, Boyd, for being with us.
It's my pleasure.
So what is Noravirus exactly?
Well, Noravirus, it's a highly contagious illness caused by a virus, an infection with a virus that's called norovirus. And actually, originally it was called Norwalk virus, and it was discovered in Ohio, in Norwalk, Ohio, and that's how the name came about.
That's interesting.
So, but it's an illness that causes diarrhea symptoms, diarrhea, vomiting, stomach pain.
So what most people might call the stomach flu or
Exactly.
something.
Stomach flu, sometimes food poisoning, but it's a form of viral gastroenteritis. And gastroenteritis is an inflammation of the stomach and intestines.
So you said highly contagious. You don't have to have direct contact with someone. How is it passed around?
Sure, and by touch. So you don't have to have direct contact with that person. It can actually be surfaces in the environment that have been contaminated by that person or their body
Like a
fluids.
phone or an iPad?
Could be a phone, or yeah, exactly.
And I understand that this virus is very durable, that it survives for quite a while on the surface.
Yeah, that's one of the problems with transmission. It does survive in the environment for a while. And the other thing about this virus, it doesn't take very much virus to actually make you sick. So that's another reason why it's so highly contagious.
You mentioned a couple of the symptoms. What would be other symptoms that someone might experience? And like the flu, does it come on suddenly?
It can come on very suddenly. Actually, you don't have to have fever or any symptoms like you do with a cold or a flu where you feel it coming on. You can just all of a sudden have vomiting and developing, and so it can come on very quickly.
And it's interesting that we're hearing so many cases of this And we're not hearing as much about the flu or influenza this winter.
That's true. They sort of replaced each other a little bit, although influenza is now starting to go up a bit in the community.
Which is sort of late in the year in March when you think about it. Typically it's more that January, December, February kind of time frame.
Exactly. We usually see peak in Minnesota in early to mid-February, so this is a later season for sure.
Is it because people aren't indoors as much with this mild winter?
That's one of the theories is we see more illness spread, whether it's norovirus or influenza, when we're all gathered together and in the middle of the winter season in particular.
So how do you treat norovirus?
So there isn't a vaccine to help prevent norovirus, although there's some research that's being looked at in that area. There isn't a specific treatment for norovirus. It's typically treating the symptoms. The most common complication of norovirus infection is dehydration, and that's the thing you really want to watch for. You want to make sure you're taking fluids in because you're losing fluids as well.
So especially maybe for the elderly or maybe the very young?
Yes,
or
exactly.
Someone with a compromised immune system?
That's exactly right. They're at most risk for developing complications from dehydration.
And how long does that usually last? Is it 24 hours, 48 hours?
The good news is it's typically 24 to 48 hours, maybe up to 72, but typically within 1 to 2 days people are starting to feel better.
But I've heard a couple of colleagues saying how they just felt so sick.
Yeah, it's not a pleasant experience while you're actually ill, and you can be still shedding, still potentially contagious for up to 3 days after symptoms have stopped. So if you are someone who works in a food service industry, the recommendation is to not return to preparing or serving food for up to 3 days after you've been ill.
Or don't go out to eat quite so much so you don't get anything. Yeah, what would be some other advice then?
So I think in terms of when to seek medical advice, one thing to watch out for is if the vomiting and diarrhea has blood present, you want to be evaluated. That could actually be a different organism causing the infection, so you want to be evaluated for that. But again, if you're not able to take fluids in, and there's a concern about becoming dehydrated, it might be necessary for you to go into the ER or to the hospital to have fluids by IV.
So how do you know when you should go to the hospital, or when you should just go to the doctor, or when you should just lay low at home?
Most of the time people do well just staying home. If they can continue to try to take fluids, which can be a challenge, especially early on in the illness, but if you're finding after a day to 2 days you're not taking in fluids, when you're dehydrated, you can start to develop headaches that don't go away, and so that's a time to really have somebody help to watch if you're not taking fluids.
And is this okay to treat it with anti-inflammatories or things like that to help make, I don't know,
yeah, there's really,
you have a headache or?
Yeah, maybe for the headache symptoms, but oftentimes there's just no specific treatment. It's keeping things down, and sometimes if you're taking other types of medications, it can be hard to keep them down.
What would be some other ways to prevent that dehydration then if you're dealing with this?
So it's really clear liquids, things that aren't really sweet or certainly not anything that's creamy, not a milk product, those would be most difficult to keep down. And so water or Gatorade or those kinds of things that have some electrolytes in them are a good thing to try.
Anything we can do to prevent getting it?
Well, I wouldn't advise just staying home alone all winter long, but hand hygiene is really one of the #1 things, again, to help prevent the spread of norovirus. And with diarrheal illnesses, GI illnesses, we recommend soap and water. Alcohol sanitizers that are very popular and very effective aren't as effective with norovirus, so although they can be used, we still say soap and water.
Wow, that's interesting. And what if, let's say you had a coworker who came down with it and she's at home but she had been at work? Is there certain things that you should be doing to clean the surfaces or the environment at work? Yeah,
absolutely. That's an important thing, thinking about the environment as a potential source. So if you're caring for somebody who has the illness, or you've been working with someone who all of a sudden had symptoms, a good thing to do is to use a bleach disinfectant solution in the environment. Not all disinfectants work well with norovirus, so bleach is what's typically recommended. And there's a concentration that's recommended to be most effective. And if you're at home, the easiest thing is like 5 to 25 tablespoons per gallon of bleach.
Okay. Any other place where they can go to get some more information on, like things like that would work to help disinfect?
A couple of good websites that I typically go to. The Minnesota Department of Health has an excellent resource area on norovirus, so I recommend that site. And the Centers for Disease Control also has an excellent website that you can go to. And actually you can link through that from the Health East website.
Final advice for our viewers out there?
I would say good hand hygiene. Keep your environment clean and disinfected. Don't go to work ill, because you're a risk to your coworkers and to others as well. And if you need to prepare food, don't do it while you're ill. Let someone else prepare food at your home.
All right. Thank you, Boyd.
Yeah,
Great
welcome.
advice. Nice having you with us, and thank you again.
Thank you.
And we'd like to thank you for joining us. We hope you'll join us next time in Inside Healthcare. We'll see you then, everyone.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.